Installation of SafeBreak Vascular into a peripheral IV line is fast and simple. Before we begin, let's briefly review the purpose of the device. SafeBreak Vascular is installed between the needleless connector and the IV tubing from the pump. When a damaging level of force is applied to the line, SafeBreak is designed to separate to reduce mechanical IV complications requiring an IV restart. Installation of SafeBreak Vascular into an IV line only takes a couple of minutes. The equipment that's needed is a packaged SafeBreak Vascular, an alcohol pad, a roll of tape, and a saline-locked IV. Installing SafeBreak can be done in 3 simple steps. Connect and prime, scrub the hub according to your hospital's policy, and connect to the needleless connector. Let's go over those steps again in more detail. Step 1. Connect and prime. Start by peeling the lid off of SafeBreak Vascular and set it aside in its tray on your workstation. Next, take the IV tubing from the pump, remove any end cap that is covering the tip of the tubing. Pull the SafeBreak out of its packaging, connect to the IV tubing from the pump. Be careful not to contaminate the device. Prime the device through the IV tubing until you visualize a drop of fluid come out of the SafeBreak. Step 2. Scrub the hub. Holding the primed SafeBreak in your hand, open the alcohol pad and scrub the needleless connector hub according to your hospital's policy. Dispose of the alcohol pad. Step 3. Connect to the needleless connector. Thread the SafeBreak Vascular onto the patient's needleless connector. Make sure to attach the SafeBreak to the clave completely by twisting until there's a tight seal. Now the saline-locked IV is better protected with a SafeBreak Vascular installed in the line. Take a small strip of tape and apply a J-loop to further secure excess extension tubing, creating a small amount of slack between the edge of the tape and the needleless connector. With the installation of SafeBreak Vascular complete, the infusion of the patient's medication can begin. When using SafeBreak for an intermittent infusion, disconnect SafeBreak from the needleless connector or clave and place a cap on the end of SafeBreak. Step 4. Replacing a separated SafeBreak. Before you attempt to replace a separated SafeBreak, make sure you have a new SafeBreak and an alcohol pad readily available. Start by opening the new SafeBreak and leave it in its packaging tray so it can be grabbed easily later. Next, grab the IV tubing with the separated SafeBreak components still attached. Remove the separated components from the IV tubing and discard. Be sure not to contaminate the tip of the IV tubing. In the event of a separation, you may prime through the IV tubing as previously stated, or with a saline flush, and then connect to the IV tubing. From this point, repeat the 3 simple steps from above to install the new SafeBreak Vascular. Connect and prime, scrub the hub, and connect to the needleless connector. According to your hospital's policy, at the time of the line change, SafeBreak will also be replaced. SafeBreak is not for use with blood or blood products. Thanks for watching, and let's start saving lives together with SafeBreak Vascular.